Hi, my name is Dr. Vince Monastra, and I'm the director of the FPI Attention Disorders Clinic in Endicott, New York. I'm also the author of a series of books written for parents and educators and counselors and healthcare providers on ADHD, how to diagnose it, how to treat it. I wanted to talk a little bit today about one of the most common questions that I get when people come to my clinic, and that is, how do I know if my kid has ADHD or if something else is causing the problem? By the time most people come to see me at my clinic, they're concerned about their kid's attention. They're not sure why their child's having problems, but their child seems forgetful and distracted. They have to remind their child a ton of times to do simple things like get dressed, put their stuff away. When it's time to do homework, the kid's everywhere but sitting at the seat where they're supposed to. If the parent leaves the kitchen where the kid's doing the homework, the kid's all over the place and they have to constantly redirect, constantly remind. And they'll usually tell me that the teachers are observing the same thing. They'll tell me that at school, the child might just sit there and not get anything done, looking around the room. Some of the kids are real restless, some of the kids are real impulsive and will talk out in class without really waiting for the teacher to finish what they're saying. And so by, again, the time that people come to see me, there's been a discussion that they've had, usually with the teacher, sometimes with their pediatrician, definitely with their spouse, about the fact that their kid's having problems paying attention and nothing that they're doing is helping. And so they come to see me. Now, it's not a real hard thing to figure out that a child's having problems paying attention when you ask the parents or the teachers. They're readily able to tell you all the different attention problems that the child's having. But what they can't be sure of is why those problems are happening. So one of the most unfortunate things that happens for kids is that they go and their school or their parents fill out a rating scale, and the child ends up demonstrating on the scale that they have more problems paying attention than the typical child based on a rating. And so the unfortunate side is that people jump to the conclusion that the child has ADHD. And that can lead to some really bad consequences. Although most of the kids that will have an elevated rating of inattention or restlessness will have ADHD, that may be the case statistically, the fact is that there are a number of other medical conditions and visual problems that can cause symptoms of inattention. And they don't occur in just a couple of the kids out of 100. They occur in a sizable percentage. So let me just talk with you a little bit about the kinds of things that can cause a problem with attention. We'll take a next step, and our next step clinic will be to do some testing of attention. So the child will do some computerized testing of attention, where they'll sit for about 15 minutes and they'll work on a task on a computer. And what we're checking out is, can the child sit and focus and concentrate for 15 minutes doing something that's about as boring as doing math problems or doing your spelling work? If we still see a problem on that kind of a test, we'll take it one step further. And this is where my research and the research of a number of the people on my research team have been digging in for decades now. And that is looking to see if the attention problems that a child's having have to do with anything physical. And so the test that we developed is an EEG. We use a quantitative EEG and we look at how much time the person's brain physically looks like it's not paying attention compared to how much time it physically looks like it is. The concept behind it is pretty simple. When you're asleep, your brain has a certain pattern of pulsing electrically, and we can pick that up on an EEG. When you're awake and you're not paying attention, we have a characteristic pulse that our brain shows when we're not paying attention. In fact, when I was teaching at Marywood University, one of the things I'd ask my students to do would be to volunteer to be in the classroom with me recording the electrical pulse from their brain as I'm giving a lecture. That was my quality assurance. It was my way of seeing if I was really boring the living daylights out of my students. And sure enough, every time I would see a slow signal coming off the center of the brain that did this attention job, I would call on that student and ask them to summarize for the class what I had been talking about. And they'd never be able to. So there are physical characteristics that we can see on an EEG that indicate the person's not paying attention, and physical characteristics that show when they are. And so we use that test. And what I'm looking for is whether the person has an abnormal pattern. Most kids and most adults who have a medical problem messing with their attention will show a pattern of too much slowing, underactivation of the frontal lobes as the person's involved in doing tasks that require attention. But about 10 to 20% will have the exact opposite problem. For them, the issue is basically that their brain is overly activated, thinking too much, working too hard. Well, when we find out from the EEG that a person actually has some atypical characteristics, their brain is overly activated, their brain is not activating enough when they're looking at materials like a book or something like that, that's my first indication that I'm dealing with something physical and not motivational. And that is a biggie. That is such a biggie, because I can't tell you the number of kids that I've worked with where the basic question has been, is this child depressed? Is this child just unmotivated? Is this child someone who is essentially not caring and being defiant? Or are we talking about a kid who, no matter what you did, no matter what you took away or what you gave them, that child was still having problems paying attention? Well, to me, when I find an atypical finding on an EEG, when we're looking at the activation of the brain, when I see an atypical finding, I know I'm dealing with something medical at that point. It's not to excuse a child when they're not doing things that they're supposed to, but it does provide me with a real clear evidence that I'm dealing with something medical. Now, the fact that I get an unusual EEG recording doesn't mean that the child has ADHD either. But what it does mean is there's something medical going on. And so the next step in the evaluation, whether it be at my clinic or anywhere, the next thing that the doctor should be doing is trying to figure out what in the world is going on. What's causing this underactivation of the frontal lobes? Some of the problems that we've come up against and we've discovered as we've done follow-up medical evaluations is that about a third of our patients, about 1 in 3 kids that come to see us at our clinic, has a vitamin D deficiency. And the symptoms of a vitamin D deficiency are problems with attention and problems with mood. I've had children diagnosed and teenagers diagnosed with bipolar disorder, conduct disorder, and all sorts of other things, when in fact what was going on is they had low vitamin D levels, and folks living in the northeast parts of the United States very commonly will have those kind of problems. So we will ask for the docs to run routine labs looking at things like vitamin D deficiency particularly. We'll have a lesser percentage of kids that we'll work with and teenagers that we'll work with who end up with anemia. Hypoglycemia. We'll have kids that come to see us who have vitamin deficiencies for things like vitamin B deficiencies, zinc deficiencies, magnesium deficiencies. Some of the kids that we'll see will actually have some reactivity and sensitivities to foods like containing gluten, to foods that are high in wheat. There'll be kids that have problems with attention because they have allergies to foods containing corn and other kinds of products like that. And so we'll screen for those things. The net out of that next stage of evaluation is to give me an idea what other kinds of medical problems may actually be causing the difficulties, and we'll treat those first. Another kind of problem that isn't picked up in a routine evaluation or in even lab work done by a physician are visual problems. Now, when we first started working, when I do an EEG, I need the child to be still. I need their eyes to be focused. And one of the things that we found in our EEG studies was that a lot of the children, it seemed to me, were having a real hard time focusing their gaze and looking at one thing and keeping their eyes on it. Their eyes are moving all over the place. We're seeing all sorts of evidence of subtle movements on the eye. On an EEG, that's considered an artifact, something that we don't want to see. We want the child to be still, eyes looking forward. And yet, I was seeing a number of children that were having problems sustaining their visual focus. I was puzzled by that. And so after I started working with a number of these kids and began to see that no matter how many times I asked them, just keep still and keep your eyes focused, they had a real hard time doing it. So I started consulting with eye specialists, and in particular in my area, Dr. Gary Williams was a person that I would go to repeatedly because he offers one of the most comprehensive evaluations for visual tracking and convergence problems that I've seen anywhere. And so when I'm working with Dr. Williams, if I see a kid who has problems on an EEG keeping their eyes focused, and when I ask parents questions about whether the child skips lines, skips words when they're reading, reverses letters, if I find that that's a characteristic, I'll refer them to someone like Dr. Williams. When I do that, what we've found at our clinic is that about 20 to 25% of our children that we see on a year-to-year basis actually have undiagnosed and untreated visual tracking or convergence problems. And there's no medication that's out there that's going to take that problem away. And so when you're going to get your child evaluated for possible attention problems that may be ADHD or not, what you want to do is you want to make sure that the evaluation is comprehensive, that it goes beyond just looking at whether there are an unusual number of symptoms of inattention and begins to go further and examining what the medical causes may actually be. Once you do that, you're in a position to effectively treat attention problems and behavioral control problems. And then any kind of follow-up counseling that might need to be done, which we really enjoy doing at our clinic, will focus on the skills that the child doesn't have. So a lot of the children that have had difficulties paying attention during a conversation, they're not really good at having friends. They don't really pick up the cues that they need to. And because of that, they might be really down on themselves because no one wants to hang out with them and play with them. They might have problems with frustration because they can't really figure out what's going on. How come I don't have friends? And so one of the things that we can effectively do once the child's been treated for their attentional problems, whether it's because of ADHD, which we can treat both with medications and other kinds of training procedures like biofeedback, once we've treated the attention problem, then we're in a position where we can start to begin to treat the child and develop the skills that we need to. And that's the stuff that we do a lot of and we've written about in our books that we've published and are out there available for people to read. So those are some thoughts that I'd share with you about the diagnosis of ADHD. I hope you find it helpful.